Good evening, everyone, and thank you for joining us for this virtual town hall this evening. My name is Kendra Kadoff. I'm a special education teacher, reading specialist, and current president of the Farmington Education Association. We're excited for tonight's event. Before I hand it over to Representative Craig, I would like to go over the agenda for this evening. Shortly, Congresswoman Craig will provide an update on her work in Congress, and then Dr. M. Kumi Smith, Assistant Professor of the University of Minnesota School of Public Health, will give an update on the coronavirus pandemic. Following their remarks, I will be asking questions that you all will comment below here. And tough questions are great. They are welcomed, but obscenity is not allowed and those questions will not be asked. So with that, I will hand it over to Representative Craig to lead us in the Pledge of Allegiance and give her opening remarks.
Well, hello, everyone, and greetings from Eagan, Minnesota. So happy to be back here this evening. I always start my town halls off by recognizing this nation's veterans. So if you're a veteran or a family member of one, thank you so much for your service to our community. And now let's all join in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much. And Kendra, thank you for coming back and hosting. Kendra was scheduled to be our in-person host in Farmington back in April when we had to take our town halls virtually and online. So Kendra, I want to make sure I recognize you here today. She is an instructional support facilitator at Farmington Area Public Schools. And thank you so much for all of the work that you do, but as well as every single educator throughout this congressional district. You obviously are incredibly essential workers, and it means the world to have you moderate my town hall here this evening. I also want to welcome Dr. Kumi Smith. Dr. Smith is the assistant professor of the Division of Epidemiology and Community Health at the University of Minnesota. So we want to continue our pattern of having a public health expert with us each month as we have our town halls. And with that, I want to turn to some opening comments that I will make. I'll then turn it over to Dr. Smith, who will make her own comments regarding where we are with the public health crisis we find ourselves in. And then we'll open it up, as we always do, for your Q&As. This is my 20th town hall, and I have to tell you, I can't wait to be back with you in person at some point. I am incredibly proud of the work that we have done together in my first term in Congress. I've been able to get 2 bills, as many as any member of the Minnesota delegation, and the largest number within the freshman class of the Minnesota delegation, 2 bills signed by the president over the course of my first term. I also continue to be incredibly proud that over 2/3 of the bills that I have either co-sponsored or authored have been bipartisan. And I continue to work with my colleagues, both Democrats and Republicans, on issues that are important to the 2nd Congressional District of Minnesota. Since we last met a few weeks ago, I've introduced bipartisan legislation with Jeff Fortenberry of Nebraska that would cut insulin prices. Healthcare is and continues to be, even before the pandemic, the #1 issue that Minnesotans talk to me about. And we've also been able to get through the National Defense Authorization Act, a couple of really important amendments to me. One, an increase in appropriations and support for military families, Army families specifically, as well as a piece of legislation that I helped introduce last year, the Seeding Rural Resilience Act, which increases funding for mental health in rural areas, also made it into that appropriations package. Just last week, when I was back in Washington We also passed a piece of legislation. It's called the Child Care is Essential Act. It would provide $50 billion in absolutely critical child care funding throughout the country. It's a stabilization fund. Child care is so important to reopening our economy, and we'll get more into that in here in just a second, I'm sure. But that would bring $682 million to the state of Minnesota. In the appropriations bills, we were back in DC for 2 weeks, I guess a week ago for those 2 weeks. And we were able to put through a number of appropriations bills. And so I just want to go through a number of the things that I am most proud of fighting for the 2nd Congressional District. The first is a $200 million increase to IDEA funding. You all have heard me talk about the need for special education funding in our country. We appropriated in this bill $1.4 billion in funding for special education across this country. We also increased our grants for career skills and technical education, another passion area for me. We appropriated $47 billion for the National Institutes of Health, $1 billion to infrastructure for Tiger grants and Bill grants, those really important grants that our communities right here in CD2 apply for, and that I'm happy to support over the course of my term in Congress. Also, we were able to get additional appropriations for the Reconnect program, which supports rural broadband, which we all know has become painfully obvious that there's inequities between rural and urban areas, suburban areas, when it comes to access to high-speed internet. In addition, I just want to reinforce that I am so proud of my district office team. As your member of Congress, one of the most important roles that I play is to have a team behind me who is here to serve our district. And over the course of the last several weeks, we passed the $500,000 mark in dollars that we have returned directly to constituents by being able to help you battle through the red tape and get the money that you deserve. Many of these come through Social Security, disability benefits that you're eligible for, that you needed a little help with. A lot of these come through our work with the VA to help you get access to the benefits that you deserve. So I just want to give a shout out to my district staff and the caseworkers in particular for all that you do, as well as to the constituent services folks who work with our cities and our counties and our towns. I want to pause here and just pivot a little bit to some remarks on the public health crisis that we find ourselves in. I know a lot of folks here lately have said they now have Zoom fatigue because we've been meeting together so much virtually and electronically. But I want to make sure that we're all grounded here tonight in the data. The data are that nearly 20 million confirmed cases of COVID-19 exist now worldwide. There are over 720,000 confirmed deaths from COVID-19. We have over 160,000 deaths in the United States of America. 160,000 Americans have died from COVID-19. Nationally, our unemployment rate is at over 11%. Here in Minnesota, it's just under 9%. And we continue to have a twofold crisis that results in a number of other things that happen as a result. The first is we just cannot forget that the highest priority is to suppress the virus. The highest priority is to ensure that we're investing in helping to suppress COVID-19. Now, I know there are economic impacts as well. As a member of the House Committee on Small Business, I have been right in the middle of the design, the development, the rollout, the extension of the Paycheck Protection Program. And I want you to know that in this congressional district, 10,386 loans, 10,386 businesses were able to take advantage of the Paycheck Protection Program in our congressional district alone. Of those, almost 9,000 of them were loans, forgivable loans of $150,000 or less. So 9,000 of the 10,386 really went to help the smallest of small businesses. In early May, the U.S. House of Representatives passed a COVID relief bill. That would have been the fourth COVID relief bill that I have voted for. The first three were done on a very bipartisan basis. In early May, we passed the HEROES Act. To date, nothing has been brought to the floor of the Senate. And I'm going to repeat this. To date, nothing has been brought to the floor of the Senate. And the reason that is the case is simple. As Mitch McConnell has indicated, that he doesn't have the votes for another relief bill from his caucus. You know, here we are, and the unemployment insurance at the federal level has run out. Here we are, and states and cities and counties and schools are looking at laying off essential workers in our communities, local folks. The economy is at a very crucial moment in time right now. You know, the Minneapolis Fed President Neil Kaskari often says to me, because he gives counsel to the entire delegation, that if you look back and study the Great Depression, it was the decisions that the Fed made, and it was the decisions that the Congress made that tipped us over the edge into a sustained depression. And that if we make bold policy decisions on a bipartisan basis to help support our economy now, the goal is to only end up in a recession that we can dig ourselves out of, and not to have us fall into another Great Depression. We still need a federal strategy for testing, for contact tracing, for isolation. Absent that, we are not going to be able to fully reopen our economy, to feel confident we can send our kids back to school. We are not going to be confident that we keep each other safe, and more Americans are going to die. So yesterday, I introduced, alongside my friend and colleague, Senator Tina Smith, a bill called the Suppress COVID-19 Act. And this piece of legislation would provide $25 billion to states for contact tracing, $25 billion to test administration, because the simple truth is, if you don't get your test results back for multiple days, it makes contact tracing impossible. It makes suppressing the virus and stopping community spread impossible. And so I'm proud to be working with the senator. It's bipartisan, it's bicameral piece of legislation. And while it doesn't replace the need for a federal strategy in these areas, what it does do is it allows states to put together interstate contracts, compacts, regional agreements, so that they can band together to get their testing components and supplies. So they can band together to work with manufacturers and get that done, instead of competing with one another. So with that, I want to say that there's an awful lot of work that has been done. I've been very proud of the bipartisan way up until this point that the Congress has behaved when it comes to working together to fund what is needed to help our economy, to fund the healthcare resources that are needed to fight the virus. And I just hope that we can get back to the negotiating table and get the next package for the American people put forward. And with that, I want to just say thank you to all of you who are here tonight, listening again in my 20th town hall. With that, I'd like to just give you a little more information on our public health expert guest here at the town hall this evening. Dr. Kumi Smith, as I said before, is assistant professor of the Division of Epidemiology and Community Health for the University of Minnesota School of Public Health. She studies HIV and STI epidemiology, particularly in resource-limited settings. She also is interested in infectious disease dynamics, social determinants of health, which are critical, and health equity. So with that, Dr. Smith, I again want to thank you and welcome you to our town hall this evening and ask you to make some opening remarks.
Great, thank you. Thank you so much for having me, Congressman Craig, and it's nice to meet everybody virtually. I do just want to qualify first what I can and cannot tell you about. So I'm an infectious disease epidemiologist, and I work in an academic setting. I do work with the Minnesota Department of Health, helping them with the mathematical modeling projections. We talk a lot about the data, we talk about what's going on. However, I don't make the decisions around what the state decides on policies. I do try to give whatever guidance they need to make those decisions, but funding allocation on all those kinds of things are not my wheelhouse. So I do just want to say I can weigh in on some things. I may not be able to answer all your questions. So with that, I can give a really quick update, very broad strokes of how we should be feeling about COVID now as we're approaching school days. You may have noticed in the news that what happens with COVID is that there's a lot of variety, a lot of heterogeneity across the country. Earlier, we were hearing about surges in the Sun Belt. Now we're hearing that that's creeping into the Midwest. From what we can tell, that does seem to be true, that if there is going to be a resurgence in cases, that the Midwest is next. So this does mean that we cannot let our guard down and that we really do need to double down our efforts. And this is for two reasons. One is because reducing community transmission is one of the best things we can do to make school reopening, in whatever format it will happen, as safe as possible. And secondly, as we move into fall, we're moving into indoor heating weather, as we call it. This means more of us will be indoors, and that really does amplify viral transmission. So these are sort of slightly dire updates. I'm not here to scare you. I'm here to sort of give you a dose of healthy reality that hopefully empowers you and informs your decisions as a family and as a community. So with that, I do just want to make one or two comments about what COVID means in relation to schools. So if you've been following experts, you do know that COVID does not affect us equally by age. That is to say, it's far less lethal to children, and children experience severe disease from COVID far less often than older folks. And that's great news. That's a relief. However, when we talk about school reopenings, do keep in mind that this is not a conversation just about the kids as students, but it's about communities and what it takes for communities to reopen. There are the families that have to participate in this, educators, administrators, lots of support staff need to be in schools to help make school reopenings happen. Even if your school is completely virtual and completely distance learning, there are professionals behind the scenes who do have to be physically working together to make that possible. And so when we talk about how to do safe school reopenings, it's important for us to think of ourselves as a community. It's also important to remember that if we do have amplified transmission among kids, as an epidemiologist, that's something that we have to care about, because COVID does connect us all in unfortunate ways, which is any sort of amplified transmission in one corner of society will eventually reach every other pocket. And this is going to translate into more hospitalizations and more deaths that may have been avoidable. So this is a large part of the conversation from the disease control point of view that we are keeping in mind when we think about school reopenings. I do also want to say, when we think about COVID, we sort of fixate on this really scary disease. It's practically all we talk about these days. but it doesn't mean that we should let go of the other important health things that we already know how to do. So especially for youngsters, we know that it's so important for them to pay attention to diet, for all of us to pay attention to diet, make sure that you're getting exercise, spending time outdoors, socializing with folks safely. And, you know, given that I'm talking to you through a screen, it's kind of ironic, but of course, minimizing screen time is also great too. So making sure to take care of our physical and mental health as much as possible is also really important during pandemic. I would say finally that I think pandemic has us all feeling really helpless. And if you feel that all you can do right now is to stay at home and, you know, be really concerned about this pandemic, I do think that one thing that we all can be doing is to be doubling down on our efforts to reduce community transmission. As I said earlier, getting the transmission in the rest of society down to a certain level will be really important to make sure that school reopenings are as safe as possible. And as Congressman Craig was saying, the sooner that we can move forward and start to try to reduce the epidemic down to these much safer levels, which we've been able to see does provide for safer in-person learning in other settings in other countries, the better for our children, but also the better for our economy and the better for society overall. So spreading the good word and setting good modeling behaviors, not just for your family, but for your community, are all very important. And I'll stop there, and I'm happy to, of course, take part in the Q&A session.
Well, thank you both very much for your work and for your wonderful, helpful insight. That was appreciated. And now we'll move on to our question and answer section for the evening. And our first question is for Representative Craig. Karen asks, many people are dependent upon the United States Postal Service for medicine, packages, information, and ways to connect, and in a pandemic to vote. They employ hundreds of thousands in delivery services like Amazon, and UPS utilizes the United States Postal Service as well. There are efforts underway to slow down and dismantle the Postal Service. What actions are you taking to stop this? And what, if anything, can we as citizens do to ensure that we save our Postal Service?
Karen, this is such a great question and incredibly timely. And I share your concerns that somehow we are politicizing the U.S. Postal Service, but that's not really new. And I'll talk a little bit more about that here in a minute. You know, first, let me say thank you to the just essential workers who are the letter carriers and the Postal Service workers who every day go in and help deliver the U.S. mail. The Postal Service is literally enshrined in the Constitution of the United States. It allows anywhere you live in this country to have access to, in a low-cost way, get goods across this nation. And when I think about, you know, the idea of let's weaken the U.S. Postal Service, I think about the constituent who emailed me about 3 days ago complaining that a first-class postal item had taken about 12 days to get to her, and it was a prescription drug. So we have to make sure that and we are, leadership in the House is very focused on holding the Postal Service executives accountable to ensuring that you know, things get sorted appropriately, that they get out in a very fast way, but also to ensure that the money is appropriated in our upcoming relief bill that will allow the Postal Service to do its job well. And you're exactly right. We are a democracy. We just saw what great mail-in ballot, absentee ballot, which is exactly the same thing, looks like in the state of Minnesota this week during the primary process. So we are working hard to have that in the next package to make sure that the Postal Service has the resources it needs in order to do its job. And we will continue to press for that. Thank you, Karen. That's a great question.
This next question is for Dr. Smith, and it regards contact tracing. Sue states, there are apps that can be installed on our personal devices to do contact tracing. Is Minnesota using these apps, and should we be using these apps?
Yeah, thank you, Sue. That's a really great question. I'll start with just kind of a basic overview of contact tracing and what it can and can't do. So when an outbreak first starts and we have a sense of the few people who are infected, contact tracing is really helpful for figuring out where that virus is spreading to. And it essentially consists of finding each case, interviewing them, and asking them all the people that they've had a certain type of contact with over a certain recent duration of time. Then you go out and find all of those people that were named by your first case, and then interview those people about who they've had contact with. You initiate testing with those folks as well. So if you can stay one step ahead of the virus, contact tracing is really, really helpful for containing spread. You can advise these people to get tested, to isolate, and this can be really effective in containing an epidemic. I can tell you where contact tracing doesn't work so well is once we start having large gatherings. So you can imagine if you go to a concert or a bar or some kind of large gathering, you might be standing packed in with a lot of people, and those might count as close contacts, but you won't know who those people are. You might not even have seen their faces. If that happens, contact tracing makes it really hard to effectively follow up with the people who you may have actually exposed. So as Sue has rightly pointed out, there have been a few attempts in the sort of the tech world to collaborate with the public health world, where they suggest that couldn't we use our phones as a way to sort of keep track of where people are, who they might be coming into contact with, and could this not sort of employ a route for us all to keep track of where the virus may be spreading? I think it's a really interesting idea. I personally am really interested in how mHealth or mobile health can actually improve health outcomes, given that we all do have mobile phones now. I am a proponent of it, but I do think that there are still a lot of unanswered questions with it. And I believe that is one of the biggest barriers for government level adoption of this intervention. And just two problems that I can describe offhand. One is that for this to work, we have to have a significant portion of the population download, install, register, and regularly use this app. Our trust as a society in our in companies and in tech companies to protect our privacy and to not exploit it, I would not say is at an all-time high. If that presents a barrier, especially for certain subsets of the population from using it, then this app will become largely useless to us as a society. A second challenge is that what we haven't figured out with these apps is how to use the geolocating technology on our phones to distinguish one person from another in densely populated areas. So if we have a large apartment complex in which you have a lot of people who literally live on top of each other, this device will not be able to tell apart who is actually safely sequestered in their homes and therefore not exposing each other, and who is actually in the same home or holding, a big party in their house. So these things are really hard to disentangle, making it such that we can't guarantee that apps for contact tracing are, a silver bullet for tracking the epidemic, at least not at this stage.
Thank you. This question is for Representative Craig. Lisa asks, my question is about chambers of commerce and where are we at with PPP for 501c6 organizations?
Lisa, that's a great question. My chambers would know here throughout the 2nd Congressional District that I have advocated for access to the Paycheck Protection Program for our local chambers of Congress, with the exception that we have to carve out. You can't use any of those resources from that forgivable loan to lobby on behalf of the chamber. But when I think about my local chamber here, just over the last several weeks, as you have been such a great hub to distribute, I know, mass for the state of Minnesota, such a great proponent and supporter of the small businesses, really the mom and pop Main Street businesses in our community. I've been an active proponent of including the 501c6 organizations you're referring to in it. In fact, it was in the HEROES Act, and again, I worked with leadership to make sure that there was a caveat to that on lobbying, but I do support it, and obviously it was in the House bill that passed, and the negotiations are ongoing. So I wish they were ongoing a little harder right now, but they're in the middle of discussing that. But I will continue to advocate, and thank you to the local chambers for what you're doing to really help our local mom and pop shops. And before I get off the topic of our Main Street businesses, the money that we appropriated in the CARES Act, original CARES Act, that now has been distributed to our counties and our towns, I've just been so pleased to see many of our cities and our towns and our counties opening up those $10,000 awards to small businesses, those grant programs to support the economy and help our small businesses get through this. So just thank you for your doing. I know there's stress and anxiety in the economy and the business community, which is why I believe so strongly we have got to fully fund suppression of the virus, because the only way we are going to be able to keep our economy open is to suppress the spread of the virus.
Thank you. Dr. Smith, back to you with this question. Judy asks, with teachers and students returning to school, what are the 3 top items teachers need to have or do in order to keep themselves and students safe?
That's a great question and a great way to ask it. Thanks for asking for the top 3, because I could easily go on and on. I would say that I think first of the top 3 is a no-brainer. It's PPE. And we know this because we have watched healthcare workers and doctors put themselves in the line of fire every day during this whole pandemic. And for the most part, most of them have been able to, in the face of known exposures to confirmed cases of COVID, to avoid acquiring the infection themselves. So we do know how to prevent transmission between 2 people. The question is how to do it in a sustained way over time. So I think on top of PPE, a willingness to continually revisit your guidelines and to make sure that everyone is adherent to distancing, mask wearing, and hand hygiene, I think are the most important. I think the second most important thing is to have a plan. It's really an easy thing to say that, you know, we're going to go in and we're going to be really vigilant, but things are going to be changing. This is a whole new frontier for a lot of us. And I think that it's really important that classmates, teachers, and entire classes talk together about what this is going to look like, how is it going to feel, and what are some ways that you're going to rehearse, you know, going through the awkwardness of, you know, learning and being together during a pandemic. This includes how to safely ask for space if you're not comfortable with how close somebody is. It's how to try to open up communication when you think something is not working as a group, and how to amend the plan that you have in place. And that ties into the last recommendation I have as a tool for teachers and students, which is a willingness to be nimble. What we know about this pandemic is that this virus is unpredictable, and we can have surges happen almost at any time. We are still learning about how and why and where they happen. So if we're moving forward and things are starting to get into a good learning rhythm, it's possible that we may have to retreat and go into a full shutdown. Instead of, panicking and throwing our hands up in those situations, it's best if we anticipate that and have a plan for that, and to try our best to adapt and to be willing to try new things as we move forward. Those would be my top 3 recommendations.
Thank you. And now we're back to Angie for the this question. Lucas says, "Hi Angie. Even before the pandemic, a lot of people have been struggling to pay for their medical bills. Healthcare is crazy expensive. Have you been doing anything to try to lower healthcare for people in our community?"
Lucas, thank you so much for this question. This is probably the most personal question that I get asked because I worked for 2 decades at a healthcare manufacturing company. I ran the health plan for the company in the last 4 years. I helped implement the ACA at that business. And more than that, I grew up in a family that at times in my childhood didn't have access to health insurance. I still remember the box of bills that piled up when my little sister had to go into the hospital. So to be candid about it, I have worked on the topic of healthcare more than any other since I've been a member of Congress representing this district. And as much as I try to work across the aisle and on a bipartisan basis, and we've had some success with things like the State Premium Reduction Act with Jeff Fortenberry of Nebraska that would reduce the premiums in the individual marketplace, and with him on the insulin bill that I talked about in my opening remarks. Healthcare has been one of my biggest frustrations because it is so politicized. We have got to take the politics out of healthcare because at the end of the day, if you can't afford your healthcare, it is not accessible to you. I think we have to take this conversation beyond, though, just the cost of health insurance. We've got to actually have the conversation about the cost of healthcare. And so here are just a few of the things that I'm supporting. One, I think we need a public option that would compete with the large insurance companies, give folks more choice, especially in the parts of my district like Wabasha County where we don't have enough choice. Les in my district pays $24,000 a year in premiums with a deductible that's over $10,000 if he actually needs the care. That is not health care that people can afford. I also think that we have voted for the right to have Medicare negotiate drug prices as part of a bill earlier this year. And then I'll just end with this. The Patient Protection and Affordable Care Enhancement Act that we passed through the House. It was H.R. 1425, which is the base of my bill that passed the House. It would do a number of these things. It would reduce the cost of insurance in the individual marketplace. It would provide incentives for the states that haven't expanded Medicaid to do that. And it would allow about 4 million more Americans to have access. And then, I'm going to pivot to just say, the Trump administration, and I work with this president a lot on issues where we can agree, is trying to have the entirety of the ACA tossed out in the middle of a pandemic. There are 51% of non-elderly people in my congressional district have a pre-existing condition. So my response to you is, Lucas, I'm working on it. It's more partisan than it should be. We ought to just sort of agree today that the healthcare system we have is the system we have and that it needs to work for more working Americans, and we ought to drop the politics and just work together to get it done.
Thank you. Dr. Smith, Deborah asks, what do we know about the future of people who were carriers but had no symptoms?
That's a great question, Deborah. So, and the question that all epidemiologists dread because there's so many unknowns when it comes to asymptomatic infection. I can tell you one of the reasons why this is so hard a question for us to answer is because it's very hard to study. By definition, people who have the virus but don't have symptoms are just like any other uninfected person. They're probably not going to go to the doctor. They're probably not going to seek healthcare. And so we as a healthcare system and we as, a group of people studying this were unable to capture who these folks are. But we do know a few things about asymptomatic infections. One is that over the course of a person's infection, for those who are asymptomatic, their disease course in terms of what the virus looks like and what the viral levels look like in a patient, it's pretty similar to someone without symptoms. This means that people with asymptomatic infection are just as infectious as those without symptoms. And so that's what's really scary about this virus, is that we really can't tell if we have the infection. And if it does happen that you do have the infection, there's a very high chance that you could be spreading it to people without knowing it at all. I will add one extra thing that we're learning about this epidemic and in terms of how it spreads is that even among cases who are infectious, not all of them spread in the same way. We're not sure why, but some people who have the virus and who are infected, regardless of whether or not they have symptoms, end up kind of contributing to what you may have heard of as super spreader events. Super spreader events are really rare. In fact, we think it's the real small minority of all cases that end up kind of transmitting to like super large numbers of people. And the rest of cases end up transmitting to really very few, if any, other kind of secondary cases. But the fact is that when we talk to folks who end up having been a super spreader themselves, at the time they had no idea that this was happening. So this is where we really need to exercise caution when we're talking about reopening and sort of moderating your own behaviors, because there's really no way for us to tell you this is the telltale sign that you're probably contagious to other people. And so if you don't know, the best assumption is just to always assume that you present some risk to those around you and to therefore take precautions as such. So I hope that answers at least some of your question, Deborah.
Thank you, Dr. Smith. Representative Craig, Taylor asks, what is being done to protect students financially who have and will continue to graduate into an increasingly unstable economy?
Well, that's such a great question, Taylor. I have one son who graduated from university in December, and it took him about 5 months to find an entry-level job. And I think, that's going to be the challenge with COVID-19 is that a lot of folks are unemployed. A lot of companies are pulling back their investments. But what I think we have to do is really at the public policy level invest in things like the 21st Century Workforce Act, which Tina Smith and I have introduced here in Minnesota, those public-private partnerships, so that we can make sure we are matching folks who are in the job market to with the job skills that are actually being hired in our local communities. And I think that career skills and technical education and matching folks to the job, we've done just a dismal job in our country over the last couple of decades at making sure that that's the case. The other thing we're going to have to do is we're going to have to look at that student loan debt, the interest. We may have to defer some of that for longer than we would like. But at the end of the day, we have to work with companies to figure out what does this new post-COVID-19 economy look like? It's going to look different than it did before. The jobs may look a little bit different than they did before. I think about, the virtual education explosion. I think about how much of the virtual healthcare that we've seen as a result of COVID-19 is sustainable in the long run. So, I think there will be challenges for new graduates. I think there will be opportunities, but I definitely think that there is a role for a public public-private partnership in helping to meet those opportunities and match those resources.
Thank you. And Dr. Smith, back to you. Ibad asks, how important are masks to stopping the spread of COVID-19 in indoor spaces especially? And has this tactic been used before?
That's a great question, Abad. So when it comes to masks, I think it's always important to make sure folks keep in mind the difference between masks, or what we call surgical masks, and respirators. So I think the stuff that we all kind of wear, in grocery stores and in our everyday lives are more likely masks. So these are just basically a covering over your nose and mouth. And the main purpose of those is to stop the spread of large droplets that come out of your nose and mouth, whether you're coughing or sneezing or actually just talking or singing or anything like that. And what masks do prove to be good at is stopping those large droplets from landing on surfaces and landing on whoever you're close to. These large droplets are a big problem when it comes to disease control, and that's just because a lot more virus is in these large droplets. So if those droplets land on somebody, there's a lot more virus landing on them, and it makes an infection much more likely. The second kind of thing that looks like a mask is actually a respirator. And so that's what you might have heard of folks talking about N95 masks and things like that. Those are much more tightly fitting masks that are often used in healthcare settings, especially for those who have primary contact with confirmed cases. These are masks that actually control the airflow and can screen out really, really tiny particles, including aerosolized virus. So when we're breathing or talking, large droplets might be trapped by a mask, but they will still allow the aerosol particles that just come from your breathing to escape the mask. Respirators will stop those. So I think we know about all these kinds of things from studying how much of the virus escapes from a patient when we put them in a lab setting and fit different types of masks on them. But I think the most sort of practical knowledge we have about why this stuff works is because we have a very kind of unfortunate lab in the form of all of our frontline healthcare workers who are in environments with known exposures and who are managing to stay COVID-free for long periods of time. So for these reasons, I would say masks are much more sort of what we want to use in our everyday life. But if you are in an enclosed space with other folks for long periods of time, and you don't have a respirator, there could be cause for concern. And so I think if you're not a professional who really knows how to use a respirator, I can tell you I'm not. I would not trust myself to fit myself for a respirator. The main advice that we can offer is to avoid the 3 C's, which they call avoiding closed spaces, avoiding crowds, and avoiding close contacts. I hope that's of some help.
Thank you, Dr. Smith. Angie, this question is for you. Siri asks, what is being done to help our schools, educators, and families during this difficult time?
Well, Siri, that is a terrific question, and it's been a really difficult time in a number of ways. But I think about the 14 million American children who rely on nutrition support at our nation's schools. And I have just been so proud of our local schools and how they have really adapted and adjusted to be able to continue to provide food security to the children of this congressional district. I have been a huge proponent of making certain that each of the COVID relief bills so far has money in there to support our nation's schools, especially when it comes to our special education children. As you saw, it's one of the biggest things that I fought for in the appropriations bill. It's also been an item that I fought for over $10 billion in support through the CARES Act funding to ensure that our paraprofessionals and our special education teachers can continue to meet the IEP needs of our nation's children. I know that the back to school question is a really tough discussion in every community. And the truth is that it really is a community decision. Obviously, I believe each community should weigh medical experts and science, take into account the community spread and the positivity rate in each of your community. And the one thing that I really hope is in the next COVID relief bill is money to support our schools if they are to open safely, or even if they're running a hybrid model like our Rising Senior in District 196 is running, so that when children develop COVID-19, there can be very fast testing, very fast isolation and contact tracing. And at the end of the day, we want to prevent these COVID clusters from occurring and just make sure that we never forget that we can only reopen our schools safely. We can only fully reopen our economy when we take care of priority number one, which is addressing the virus.
Thank you, Angie. Dr. Smith, Connie asks, a recent article showed that in comparing deaths this year to last or previous years, there's a massive difference in deaths, meaning that we may have underestimated COVID-19 deaths by a lot, like 40 to 50,000 in the US. So Dr. Smith, have you heard that?
I have, yeah, and I don't know, Connie, if you might be referring to the New York Times definitely led the first of those big explorations at a national level of differences between deaths last year and actually not even deaths last year. I think it was deaths averaged over the past 5 years, previous 5 years, and this year. And there is a huge gap. I think that this is really going to be hard for us to describe until a lot of time has passed. Part of this is, I think, the problem of we're having a large surge in an illness that can incapacitate healthcare systems. So there is a large amount of COVID death happening in places experiencing surges, no doubt. And there probably are a lot of undercounting of these deaths, whether it's from testing lags. There were early changes to the reporting guidelines for what qualified as a COVID death on a death certificate in the beginning. Revisions of death certificates and reporting to the CDC is always going to be delayed. And so, revisions are always kind of catching up. But then you may have also heard that there's also this kind of fallout from an overly strained healthcare system. So this can include folks who are trying to get care for urgent conditions that are unrelated to COVID. They're presenting at a hospital that's at capacity and getting turned away for care or getting delayed or insufficient care, and that results in unnecessary death. There's also been a phenomenon really disturbing of a huge drop in ED visits. So emergency departments have been reporting a drop-off in visits of very critical conditions related to cardiovascular disease or other heart conditions, things that you wouldn't typically ever abstain from care for. And it's possible that a lot of folks might be dying sometimes outside of clinical care settings, not directly from COVID, but because COVID was there, this death occurred. So we will be unable to distinguish what of these infections were actually death from COVID that we did not account for at the time, and what of them are sort of the downstream unfortunate effects of an overstrained healthcare system that then led to an indirect death. I think time will tell, but you're very right to be aware of that problem, and it's something that we're really focusing on in public health too.
Thank you. Angie, this question is for you. Brian asks, economists who have studied the problem of shortages have long known that one cause of shortages is price ceilings, government-imposed limits on how much sellers can charge for goods. That point is relevant because price ceilings are rampant throughout the United States, both at the federal and state levels. Why is Congress allowing those price ceilings to choke off the ability of the free market to produce the quantities of the goods that we so desperately need to prevent and treat COVID?
Brian, thank you so much for that question. In all honesty, that's not been something that I've been hearing about. So I'd love to connect you with my team and look at any sort of economist report on that. What I have been hearing anecdotally is that states feel that they are paying way more than they historically have for personal protective equipment because they are in competition sometimes with the federal government and mostly with each other and with healthcare facilities, especially for personal protective equipment. So if there's some additional data that I need to look at, I'd be happy to. This has been one of my primary concerns, and it's been one of the things I'm most interested in is supply chains during COVID-19. In fact, I'm part of a bipartisan supply chain caucus in the U.S. Congress. And early on, fundamentally, I believed we should have made further use of the Defense Production Act on the topic of personal protective equipment, and that the bill, as I said in my opening remarks, suppressed COVID-19, which would provide $25 billion for testing and $25 billion for contact tracing. Really is kind of the second best option. If we had a federal standard for reporting of personal protective equipment and where it was across this country, as well as an information technology system that could track that in consultation and coordination with the states, I think we would be in a much better position to move PPE where it needed to be, when it needed to be there. And I think, I know that there have been counties here, even Dakota County, made a huge investment in, I believe, testing for long-term care centers. But just think about the early days of this pandemic when we needed to get PPE to our frontline healthcare workers. We needed to prioritize our long-term care centers and nursing homes to really address the death rate in this country. So again, Brian, I'm always open to learning, and I'm glad you're here. And so I'll connect you with Nick Coe. If I could ask my team to make sure we put Nick's contact details in the public chat room so that we can get you in touch with him. And I'd love to see what economists are saying about these price ceilings.
Thank you. Dr. Smith, this question is for you. Sue asks, the Cannon Falls School District has decided to begin the fall session with elementary students having in-person classes and middle and high school students having a hybrid plan, where 50% of students will be in the building at a time. And do you think this plan puts the younger students in jeopardy of getting and spreading COVID?
Thanks for your question. I do want to reiterate that smaller children, as far as the science has told us so far, they do have equal chance of acquiring the infection and of course of spreading it as well. But they're not as likely to die from it or to experience severe complications. So there are considerations about how to try to reduce amplified transmission among the kids themselves, and of course to protect their teachers and other caretakers. But I believe probably what this school district's logic is that if we have a fully distance learning model for smaller children, it's a lot harder to have a smaller, I would say anyone under 10 years old, to expect them to kind of sit in front of a Zoom call for hours and hours and to have a really engaged learning process. Whereas those who are in high school can kind of self-manage their learning and work with the instructors a little bit better. I understand that that's been a large part of the logic for having this kind of hybrid dependent on age. A second factor is, of course, that when we have smaller kids in the school, this frees up their parents to be able to continue with their work especially working from home conditions are just really straining families. And this is a way to try to alleviate that and to allow some sense of normalcy to return to the situation.
Thank you, Dr. Smith. And thank you all so much for joining us this evening. And I really enjoyed being the moderator for this event. And I'm going to turn it over now to Representative Craig for her closing remarks.
Well, thank you so much, Kendra. I'm going to ask for a makeup in-person moderated event when this pandemic is over from you. But thank you so much for being here to moderate this evening, but also for all that you do for Farmington area public schools. Dr. Smith, thank you so much for your words of wisdom. I learned a lot tonight. Obviously, we are still learning about this virus. We are still growing as a country in our knowledge and adapting to that as we learn. Thank you to each of you who are watching this evening. It really is an honor every month to come together and take your questions. I am incredibly honored and humbled to be your representative in the 2nd Congressional District. And I want to encourage each of you to stay safe, to help keep each other safe by wearing a mask. And at the end of the day, there is absolutely no doubt in my mind that there is nothing that we can't do if we come together and work together. So thank you again. It's an honor to serve.